Good afternoon, everyone. Thanks for joining us on the media briefing for today. We're going to get started, and we're going to spend a lot of our time today talking about vaccine and vaccine hesitancy. And we're very pleased to have representatives from 3 of our local hospitals on today to talk about this because everybody is talking about vaccine. And we're going to start with Dr. Martha Blum. We know you already. We all feel like we know you already. We see you so often. But for those who don't know, she's the medical director of infection prevention at Community Hospital. And Martha, I think you're going to start us off with some myths. Tell us about what are some of the myths and how can we get past them?
Good afternoon, everyone. It's a pleasure to talk to all of you again. Now that we are vaccinating adolescents as young as 12, again, we're getting lots and lots of questions about safety and other concerns that perhaps maybe the vaccine is not right for everyone, but I'm happy to provide some additional information to say that now the 3 vaccines here in the United States that have emergency authorization have been given to literally hundreds of millions. We've given hundreds of millions of doses. And the great news is that now that we've been doing this for nearly 6 months, we see that these vaccines really are as safe and effective as was demonstrated in all of those early clinical trials. So there's a very small number of people now, relatively speaking, that were studied in the clinical trials compared to how many people have gotten these in real life, in real practice all around the world. So there are a couple of concerns that do keep coming up. One of them is, how might it affect the long-term fertility or reproductive health of women who are getting these vaccines? So there is no evidence to say that these vaccines cause any issues with female reproductive health. Women did conceive during the vaccine trials, and plenty of women who've been vaccinated have conceived and had healthy pregnancies. So there is zero safety concern at all about vaccination affecting reproductive health in any way. There's also concerns about whether or not there might be permanent changes to a person's body because they've been vaccinated. Also, that's also not true. These vaccines do not make any permanent changes to your DNA. The one thing they do is they get your body to produce protective antibodies. And we're seeing again and again that these vaccines are really very effective in generating those highly protective immune responses. So I'd say, if anything, the more people we vaccinate, the more encouraging information we get to say that they truly are very safe and effective for everyone that has already been authorized to receive them. Now, Karen, you can tell me if there were more specific directed questions, or was it just kind of a big overview?
No, you did perfectly, and that was me trying to get off mute. Too fast. I was going to say thank you very much for kind of giving us that broad overview. I think it's really good to be reminded that, we've been talking about myths for quite some time, and some of these myths just keep coming back up again. So it's good to, kind of go over them, many times, and in hopes that more people will get vaccinated. And I'm also pleased to see Dr. Joshua Deutsch from Me Memorial Hospital. I see he's connecting to his audio right now. And you know what? Why don't we give him a moment to do that? And Carla Spencer, who is with Salinas Valley Memorial Healthcare System, is also joining us today. And Carla, I really appreciate you being here because I'm hoping you're going to talk about masking and some best practices for masking.
Sure. Well, I think as we all have seen over the last year, there's a lot of confusion with masking right now with the new CDC guidance, and then, what different businesses, the state and local they're choosing to do. But in terms of masking, at this point, we're still masking in the state of California. And the mask should be worn over your nose and mouth like we have been doing. And at this point, until we get guidance from our state, California Department of Public Health or Monterey County Health Department, we are still masking here. It's tricky because, the guidance that came out from CDC talks about people being vaccinated and then being safe to remove masks. The problem is we don't know who's vaccinated and who's not. And I think that's the challenge that many people have at this point, and perhaps a lot of businesses have, whether to allow people in stores with or without masks, because how do you know who's vaccinated and who's not? So in the meantime, masking still continues here in the state of California and Monterey County, and it should be worn over your nose and mouth like we have been doing since the beginning. Does that answer your questions, Karen?
It does. And I think it's also really important to note that the state is looking towards June 15th, and I'm hoping you might address, it's only a month from now. And is there an advantage for us at the rate of our vaccination, and we're looking ahead to June 15th, what do we gain by waiting and still masking up?
Well, probably what's happening is that they're hoping that more people get vaccinated, so we reach more of that herd immunity, right? That's the goal. The more people that we have that have the immunity to the virus, then the less spread we'll have. Now that they approved, like Dr. Blum said, for adolescents 12 and up, the hope probably is, I'm thinking, to try and get more people vaccinated. The more people we have vaccinated, the more herd immunity we have, the safer we'll be. And so I'm thinking that might be, one of the reasons. I'm sure Dr. Blum too can weigh in if she has any other thoughts about that.
Sure. And then we've got Dr. Deutsch here with us from Me Memorial Hospital. And it's really great to have you here because we have all areas of the county represented, here on the media call. Tell us a little bit about vaccine hesitancy down in South County and at your hospital and its clinics.
I think South County has been doing very well. At Me Memorial, we vaccinated 15,000 people in our own vaccination clinic. Our vaccination rates in Greenfield and King City are around 62%, which is consistent with the rest of the county. Normally, the expectation is that in South County that we'll be doing worse, but it seems like we're doing the same as the rest of the county. And in Monterey County, I think there are counties doing better than us. The San Francisco Bay Area has higher vaccination rates on the whole, but we're doing, as well, if not better than I think the majority of counties in California. So overall, I think that the effort, as far as how do we look at 60% of people getting vaccinated for coronavirus, at least one shot, over the 3 months that the vaccine's been out, I guess it depends on your expectations. To me, 60% is pretty good. Some people would be like, why isn't 100% of people vaccinated? And I think there are some good explanations for that. What I would say is, from my experience in South County, none of the vaccine hesitancy comes from ideological opposition to science, opposition to the basic science of the coronavirus, the spread of infectious disease, or any far out conspiracy theories, which obviously you can tell my bias in what I think of them, but are very common and prominent in many areas of the country. To the extent that people haven't been vaccinated, it's often convenience. I just haven't gotten around to it. Oh yeah, I've been meaning to do that. And also I've been waiting to hear from my doctor. Is this something I should do? So people come into my office and they're like, hey doctor, my husband has diabetes and high blood pressure. Should he be vaccinated? Now, obviously, people who have been in these meetings know, well, the answer is, of course you should. But, again, and then once I say is like, yeah, actually, he really should be vaccinated. It's really important that he is because of those conditions. Oh, okay, we just wanted to hear from you. So I think to the extent that we are missing people, we want to get up to that 85% that's recommended and likely to cause herd immunity. To me, that's getting and meeting people where they're at, being in the schools, being wherever people show up, having vaccination in our doctor's offices, that's starting to meet the people who don't jump up and say, hey, the vaccine's available to me, I want to go get it, or at least haven't yet. Let's figure out where we can get in front of them. Because I think most of these people, if we make it convenient, will be vaccinated. There's a huge social benefit of us investing the extra resources in getting these people. And some of them just need, better access to information. They need to hear from their doctors. We need to make sure that everyone's enrolled in primary care and has a reliable source to tell them, yes, the vaccination is good for you.
Thank you very much. And I think what you're talking about, meeting people where they are, that applies to a lot of areas in the county, not just South Monterey County. Thank you all. If you would stay on the line for questions after our next presenters, I sure appreciate it. And now we've got Dr. Moreno on the line from our health department, our public health officer. He's going to give us an update on COVID-19 metrics and other information. Good afternoon, Dr. Moreno.
Hi, good afternoon, ma'am. I really don't have much to update. I think your presenters have done a very good job in giving some updates on COVID and vaccinations. So the only thing I'll just remind people is that anyone that's interested in the metrics information, we have it on our website. We have our vaccine allocation information. We have vaccination rates. We have also information on the blueprint, which is, as you know, we've been assigned to the orange tier this week. And I think your presenters covered everything pretty well. So that's it for me.
It does seem like a year though, when you've got one color and you want to get out of it, right? All right, thank you. And then our final presenter is Hillary Thayer from our Monterey County Free Library. She's our library director, and she's got some great news for us on changes in library service. Hi, Hillary.
Hi, thank you so much for giving me just a couple moments today. Let me share screen. I put stuff on slides just to have it handy in writing, and I can also paste the links into the chat for quick clicking. Monterey County Free Libraries, just a reminder, this is all of unincorporated county, plus several cities, including Marina, Seaside, King City, Gonzales, Soledad, and Greenfield. We have 16 branches spread around the county. And my best piece of news, like right away, is we have 10 of those branches open for limited in-person use. Yeah. It's browsing and computer use only. We have not yet opened stay all day, sit and study. We're not doing any indoor programming yet. Each branch is 1 to 2 days a week for 4 to 6 hours a day. They are on different schedules, so we can have opportunities around the county. And we encourage you to see the location section of our website for days, times, and contact information for the branch. You do not have to make an appointment, though you may. If you want to be sure that there's a computer available for you at a certain time, you may make an appointment. And I've listed the 10 branches here. It's Pajaro, Prundale, Castroville, Seaside, Carmel Valley, Gonzales, King City, San Lucas, San Ardo, and Parkfield. And just to let you know, Parkfield is brand new. We were going to have our grand opening last April, and we never got to open the branch to the public. So this will be the first time that the public is able to come in to see our beautiful brand new branch in Parkfield. We continue ongoing library services. Curbside pickup is continuing at every location. So even if the branch has open hours, we continue curbside pickup, knowing that not everyone is yet comfortable or available to wanting to go into a branch library. So you can continue curbside pickup and curbside print, fax, scan, and copy services. At select locations, we offer charge up. And what this is, we started this a few months ago, is we bring a charged up camp battery and extension cords outside of the library. So people can bring their laptops, their hotspots, charge up all their devices, and use our robust outside wireless at the same time. That service came out of a meeting many months ago with all the school districts about how to serve students during remote education. And a parent asked, for those of us who got Chromebooks and hotspots from our school district, but we don't have a home, how do we charge these devices? So look for charge up at your local branch. That continues. You can continue communicating with us in all forms: email, web form, chat, phone. I put our phone number right there on the slide. We continue to answer Monday through Saturday, 10 to 6 in English or Spanish. And we have activities outside libraries, activity bags, story walks, They continue at all of our libraries. Online services continue, and I'm going to paste these big long links into the chat for you. But we continue to create online engaging free programs, all ages, live homework help, academic assistance, test preparation, Job Now, which is live assistance with resumes. You can interview practice, you can get ready to take a vocational exam, all helping with job preparation and careers. We also have a service called Vet Now, and that's interaction with our veterans and their families, including live assistance navigating veterans benefits. This is all free on your website with your Monterey County Free Libraries card, which is also free. Coming this summer, little sneak preview, we are going to have a robust summer reading program again, all ages, both online and print, activity bags to be handed out at the doors of all your local libraries. And we are preparing for lunch at the library again. This is where we partner with our local school districts to be a meal distribution site for kids during the summer when school is not in session. And last summer, your county branch libraries helped serve over 33,000 meals to kids and families. We also are preparing for a great series of workforce partnership workshops and a big career resources fair. This is all coming this summer. This is my contact. I again will paste it into the chat for you all to ask me any follow-up questions. And thank you for giving me a few minutes today. I appreciate it.
Thank you. That is some really great news. It's kind of one of those other signs of recovery when you can go into the library again, for those of us that love the library. All right, thank you all. And if you would stay on the line, I've got some questions starting to come in, so we'll get started. The first question is for you, Dr. Moreno. How many more Monterey County residents would you like to see get the vaccine in the next month? And then a second part of that question, does the county health department have a vaccination goal ahead of the June 15th reopening date?
Thanks, Mance. That's a good question. So I actually don't have a number, and I think it's at this point we want to get as many people vaccinated as possible. So I think we really got to focus on continue to do what we're doing and then explore additional strategies that might get to those individuals that think they want to get the vaccine and need a little reassurance that it's the right thing to do. It'll protect themselves and their family members and their friends. So I think Joshua mentioned, I can't remember who previously mentioned, we got to continue to have, provide vaccine opportunities at places where people are comfortable and familiar with. So if that's a school site, great. We'll continue to have those at school sites. I think we did one this past week at one of the local schools. Doctor's offices, I think is also a very important place because the opportunity for a patient to have a one-on-one discussion with a physician who they've entrusted their health care for all sorts of conditions in the past. This is one more opportunity for a physician, a mid-level provider, nurse practitioner, physician assistant to talk to the patient and reassure them that the vaccines work. The vaccines will prevent them from getting hospitalized and can prevent them from dying. So I think in getting more doctors with vaccine, in their freezers and their refrigerators, and to make those opportunities increase the access points, increase opportunities, and increase engagement with people that they trust.
Thank you, Dr. Moreno. And then this next question. Oh, please jump in.
Sorry to jump in there too. It's Dr. Blum again. I just wanted to make a point about, trying to find a number. I mean, the point is that the virus doesn't discriminate. The virus only sees someone who's immune or not immune, someone who can be infected or somebody who is protected with immunity either from having recovered or been vaccinated. So there's really, not one point where a person would be unvaccinated and safe. You need to be immune to be protected from being infected. And the idea that, if we get to sort of a critical tipping point that enough people around are vaccinated, that it would basically bring the pandemic to an end. That's a great idea. But right now I want to point out the fact that our youngest children, our youngest school-age children, are still not yet eligible for vaccination. So we already have pre-built a group of people that are unvaccinated, not immune, and susceptible to this infection. So the best thing we can do is continue to work to get every person vaccinated so that everyone has that immunity, so that it is safer for people to go back to school, for kids to be around each other. So it's going to be a while, because we really need to have everyone, not just everyone 12 and older, vaccinated and protected, but it really needs to be everyone everywhere. So as long as there are still pockets of non-immune, unvaccinated people, we still have the potential to have outbreaks of the virus here in our county and really all over the country. So right now, there's not really a magic number. It's if you're eligible and in that group that can be vaccinated, it's your turn. It's time to take advantage of these very safe, highly effective, and free vaccines that are now much more available and easy to access. And I know we can point you to a lot of resources. Even My Turn now is asking do you need transportation? Are you homebound? How can we get this to you? So really, that's where we are right now. And if people just want to simply ask trusted friends, neighbors, nurses, doctors, is it right for me? I urge you all, ask those questions right now. Get the reassurance that if it's your turn, now is the time.
And I want to offer a moment for the other hospitals, if you want to add to what Dr. Bloom said, or we can go on to our next question.
I would like to just add one thing in that, the hospitals have worked close together to be out in the media and having that vaccine campaign. And there are plenty of different clinics around the county. If you go to My Turn, people can go on there and register. Our local Salinas Valley Medical Clinic has clinic times. You could go register. They take walk-ins, as I'm sure the other clinics do. So just really making a point that there's lots of availability of vaccine. And like Dr. Blum said, it's time. It's time.
Yeah, I'll chime in as well to bring up the context that the fixation for a lot of the pandemic is our healthcare system going to be overrun? And to some extent, in certain pockets of the country, it was. Now, I think that with the highly effective vaccine, we feel pretty confident that even if there is another wave, that our healthcare system isn't going to break. However, our school system is still broken. It's functioning at a certain level, but not to the extent that would allow any parent with an elementary school kid to feel happy that this would be the way that school would function moving forward. And again, because 12 and under can't be vaccinated, because teachers need to feel safe in the classroom, because every time a kid gets a runny nose, you got to pull them out, you got to get a doctor's note. These are days of missed school, these are exposures, that just even the fact that coronavirus is out there makes it difficult to maintain functional primary education with kids regularly interacting. I'm hoping that we're going to do it for the next school year, but we haven't proven that we can. And so for that reason, we really need to be vigilant in continue to attack and bring down the numbers of this virus until we really get back to full functioning of all of the major important social institutions. I care a little bit less about mass gatherings, whether people attend Warriors games or 49ers games. To me, that should be the low priority. But the fact that there is this sense of complacency of, is 85% enough? Can we get 90%? To me, until my school is reliably open for my son and other people, that school can function in full force. Is that I don't think that there should be any complacency, and especially that there are billions of people on the planet that are not going to be vaccinated at all, or it may be multiple years. There are new variants that are going to crop up. our vaccine may become less effective over time. There may need to be multiple waves of vaccination. So we want our foot to the pedal with no complacency until we get to a much better place, not just in this country, but worldwide.
And that point about complacency just dovetails into this next question. How big an issue has vaccine hesitancy become in our area? We see only 60, roughly 60% right now, and there's many reasons for that. But how much of that leftover, 40% eligible has been really based on hesitancy or concern or availability?
I'll go first. I want to just mirror back to what Dr. Deutsch said earlier. I really feel that often it's now that people just hadn't made it a priority, or it was difficult to navigate the very complex, web-based sign-up process. I think that was, for many people, the major barrier. I don't hear a lot of true hesitancy where people are, 100% resistant to vaccination. I feel like that, as we've made the vaccine far more accessible with walk-in appointments, no computer needed, not even a phone call, you can just walk up and get vaccinated. And as we've taken it out into the community, so people don't have to drive an hour out of their way or take time off of work because we have Saturday clinics. All of these things, I think, have really expanded the reach of vaccination to many people who weren't truly hesitant, but they just couldn't get to it easily, or they, again, they needed to go on a Saturday and there were no Saturday appointments and they didn't have, the time to spend on the computer doing it over and over again. So I believe as we continue to take the vaccine out into the community and make it very accessible and easy to get, we'll definitely be pulling more people in. And as we engage our primary care doctors so that they can have those one-on-one conversations with the remaining people to say, yes, vaccine is for you, now is your time, and here, just walk right in and get it.
Do you both agree?
Yeah,
Yes,
I think that's well said. I think in our area, we have, look, in my practice, I have very few patients who even ask a question when it's time for vaccination. I just, ready for vaccines? Do you want to know what they are? No, it's fine. Is that in general, we have a population that feels grateful to have access to medical care, that has closer experience to places where infectious diseases kill a lot of people, and generally trust their doctors. So that is, I think, a large national problem, and one that we have less of. The feeling of, do I have access to it? I have to go to a website, they just immediately shut down, even if, well, could you get someone? Again, that's too many steps. I mean, and keep in mind that as a community of healthcare workers, we think every day about healthcare. It's kind of our fixation, right? But to other people, right, you don't think about your roof, needing a new roof until it leaks. You often don't think about getting pregnant until, like, oops, I'm feeling nauseous and I missed my period, right? Is that people who aren't healthcare workers don't always think a day ahead, a month ahead, a year ahead, a decade ahead to health issues. Now you could say, but it's coronavirus. I mean, it defines, the world for the last year. Shouldn't everyone be jumping up, like, thinking about the vaccine? But, people are busy with other aspects. People are trying to hang on, pay rent economically, So, yeah, I think a lot of people did jump up. We saw a huge wave, certainly in the older population. We see we're close to 80% of people who have at least had a shot. But for kind of everyone else who, I'm less likely to die of this, I've got other things on my plate. Yeah, it's going to be more of a slow trickle. And I think it's really on, I don't think that we're going to have major pockets of people who say, no, absolutely not, I will never get this vaccine. I think it's going to take more of what we know works, which is building relationships, putting the messages out there, meeting people where they're at. I think if we continue to invest resources and invest effort in getting every last person, yes, I think we can get, certainly above 85%. I think we can get above 90%. But yeah, my goal is 100%. There's no one who I want to leave out of the vaccination campaign.
And one thing I'll add too, is that part of the hesitancy we saw a lot, and if you all remember, the hospitals were really overrun back in the winter months when we had the severe surge that we had in the county. And I think a lot of what happened, right, because we look at the county numbers and we could say so many people tested positive for COVID-19. However, those are the ones that got tested, right? So we know that there's more. I think part of the hesitancy was a lot of people who actually had COVID and maybe had minimal symptoms said, well, why should I get vaccinated? I already had COVID. I have my, the immunity. But the fact is that that's not going to last a long time. And the people who had COVID still need to get vaccinated. And that's a message too that we've seen a lot in the education we've been doing is people who have had COVID have been reluctant to get the vaccine because they figured they already have it. They have their own immunity, but it's important for them to be vaccinated too.
And here's
a couple other groups, right? Pregnant women, I'm breastfeeding, right? Any one of a number of reasons where, yes, we might recommend the vaccine that it's safe, but for someone who, again, they've just heard a couple of commercials, a couple of reports, they want their doctor to tell them, yes, you should go ahead and do that. There's reason in their mind where they're not coming out there ideologically, I think this vaccine is bogus, I think it's unsafe. They're like, I have a reasonable concern, I want to talk to someone trusted. So I think that, again, these are all people who will be persuaded with the right access, with the right information, I think will vaccinate.
And here's a follow-up question to that first question that we've just been answering. There are some people who have argued that there are not enough studies and would rather wait for long-term studies. How should that concern be addressed? And anyone can start.
Okay, I'll go. Yes, I think that early on when we had, just a couple, 20, 30,000 people in these vaccine trials, there was definitely a concern that it was sort of a smallish number and there wasn't a lot of long-term follow-up after that. But we're in a very different place now. We're getting close to almost a year since those vaccine trials have been fully completed. So we are getting more long-term data, follow-up data from those vaccine trials, not only about the long-term safety, which they are demonstrating that there's long-term safety of these vaccines, but also the longer-term duration of the immunity. To go back to what Carla Spencer was mentioning, yeah, there is some concern for people who had and recovered from mild or asymptomatic COVID, that their immunity may not be as strong and as durable as that generated by the vaccine. So definitely, even if you've had it and recovered, vaccination is for you. And as we get more information out of those longer term data coming in from the trials, we see now, that the vaccine gets immunity probably well beyond 6 months. But again, we just have to wait for time to pass to get a better answer for that. But the safety has really been demonstrated over and over again and at longer intervals. So, in general, for vaccines, usually we will identify safety concerns related to the vaccine within, say, the first 6 weeks or so after vaccination. The further you get from vaccination and the more rare the occurrence of whatever potential side effect it may be, it becomes increasingly hard to identify those extremely rare events that occur at a very long time interval from the time of vaccination. The likelihood that we're going to uncover some major safety concern with these vaccines now is extremely low. I do not foresee us finding any, new surprise safety concern with these vaccines now. I think what we're seeing is really the way that it is, that they're highly effective and safe.
And
one of the things I love about working in South County is I don't deal with a lot of, I read this on the internet and can you address this, concern. Yes, I think that there are many people in the country, depending on their news source, getting things off Facebook, who, are reading about a lot of, long-term concerns, the anti-vaccination groups are very strong. They're very smart in their media campaign, and they've been beating us a lot. Vaccination rates are down overall. I think vaccine hesitancy around the country is becoming a bigger problem. I just don't hear that in my community, and I don't think that is a barrier. Like people doing their own research on the internet, and then, I'm scared of getting vaccinated. Certainly not in South County. When I am in those conversations, though, I think the argument that I found that's most effective is that there's also unknown effects of coronavirus. So just like the vaccine may 10 years from now produce some unknown side effect that we don't know about, we actually, most of the focus on coronavirus has been on the deaths. And so for younger people, it's like, I'm probably not going to die. But actually, studies have shown that around 50% of people who are hospitalized who don't die of coronavirus report that they never feel the same again, whether it's their energy doesn't return to normal. I've had a lot of patients who, developed asthma that didn't know they had it before, right after they got coronavirus. Other people who didn't respond to asthma medicine, who just feel like their breathing isn't the same. We know that coronavirus goes to the brain. We've seen evidence of brain damage in people who have died of it and affects the respiratory centers of the brain. So there are a number, for all we know, if it goes to the brain, higher risk of dementia in people who have had even minor coronavirus infection, more risk of chronic lung disease, chronic heart disease, liver enzymes get elevated in every hospitalized coronavirus patient. You expect liver enzymes to be elevated. Are we going to see more evidence of liver failure in people who have gotten coronavirus? So when they approved the emergency authorization, the FDA, for the coronavirus vaccine, I think the FDA's wording was brilliant, which was that it's the known and unknown impact of coronavirus far outweighs the known and unknown risks of the vaccine. So, yes, there could be unknown impacts of this vaccine, but there are still a lot more unknown risks of coronavirus in addition to the risks we all know about, respiratory failure and death.
And so here's we have another question for you. And this you may not know this, but we can try to find this out. Where do we currently stand with vaccine appointments? Is the supply exceeding the demand? Are vaccine clinics still booking?
I can talk to that. I think at this point, for most places, I think the vaccine, is the supply of the vaccine is definitely higher than the demand. I think we've seen it across the county. At the beginning in the vaccine clinics, we were doing up to 1,000 vaccines a day, and that has, definitely come down in numbers. What I would say is, what I talked about earlier is that there are plenty of appointments available. Many of the clinics are taking walk-ins now to make it easier for people who can't do the online and my turn, and there are people in the clinics to help them get through the different screening tools and online things that they have to do. But the appointments are still there. The clinics, from what I know, are not being completely booked right now. There are appointments available. So I know that several entities are doing pods in schools, and I think like one of the physicians talked about really trying to outreach. I know we have put some vaccine in our primary care offices, and like Dr. Deutsch was talking about, where your physician is there and people might have questions and then they want to do it, well, they can get it right there in their primary care doctor's offices. So, I think people are now doing different things. We will probably do something with our mobile van. So I think people are trying to think outside of the box to find ways to get people vaccinated other than just traditional clinics. But all in all, there are appointments. We have vaccine, plenty of vaccine for the people in this county.
Yeah, the Montage Health vaccine clinics are at a variety of locations. and their appointments available, same day. So they're not, it's not like it used to be where they would, book up 5 minutes after all the appointments were released. So we have appointments today and tomorrow at the Del Monte Shopping Center in Monterey. Friday, we have appointments in Marina at the Montage Wellness Center. And then we have appointments Saturday in Seaside at the Boys and Girls Club. All of these are by appointment or walk up, and they all have the Pfizer vaccine. So this would be anyone 12 and older could just walk up to any of these vaccine opportunities in the next 4 days and get vaccinated. As a reminder, children and minors, the 12 to 18-year-olds need to come with a parent or guardian to get the vaccine, but come out as a family, bring your adolescents and get yourself vaccinated as well. Set a really great example for your kids. You go first and show them that it's no big deal.
Yeah, Me Memorial has a walk-in clinic today. We're making a big push for the younger folks as well. We don't have walk-in clinics every day. We still feel we need an appointment system, but appointments are very available, and you can often get a same day or next day appointment. It's at the hospital.
And remember, we also have 211 that people can call and get assistance in locating all of these different opportunities. So, if people are unsure if they need an appointment or can just walk up, they can always call and find out how to get to these places.
And people that are computer savvy can do mcvaccinate.com on the county website, but it depends on, what device you're using, how much time you have, how comfortable you are. There's something for everyone. That's all the questions that I have right now. Thank you all very much for coming and talking about really not just hesitancy, but really this wide-ranging issue surrounding vaccine. And we're just going to keep our fingers crossed those numbers keep going up, and the families that vaccinate together get through the pandemic together, right? I like your idea of going as a family. Thanks very much for joining us, everyone, on the media briefing today. Our next briefing is next week. We'll see you then. Bye.